Welcome back to Halal Medical Channel. We're so glad to have you here with us today. Today, we're diving into an important topic, the symptoms of acute HIV infection. This is a very important subject that affects many lives, and understanding it better can help in early diagnosis and treatment. Knowing these symptoms can make a huge difference in early detection and treatment. Early detection is key to managing the condition effectively and improving the quality of life for those affected. We're going to break down some common signs and symptoms, things you might experience if you've been infected. These can range from flu-like symptoms to more severe manifestations. But remember, everyone's different, and you might not have all the symptoms. Each person's body reacts differently to the virus, and the symptoms can vary widely. Some people even experience no symptoms at all. This is why it's often called the silent phase of HIV, where the virus is active but not causing noticeable symptoms. That's why getting tested is important if you think you were exposed to HIV. Regular testing can help catch the virus early, even if you're not showing any symptoms. We'll also touch on some of the more atypical symptoms, the ones that might not immediately scream HIV. These can include things like skin rashes, night sweats, and swollen lymph nodes. So, you've been exposed to HIV. Now what? It's a scary thought, and it's natural to feel anxious or worried. But understanding the symptoms can help you take the right steps. Well, in those first few weeks, your body's like, hold on, something's not right. This period is crucial because it's when your body is first reacting to the virus. This is what we call acute HIV infection, and it's your body's initial response to the virus. During this time, your immune system is working overtime to fight off the HIV. One of the most common symptoms you might notice is fever. This isn't just a mild fever, it's often quite high, and not just a little I'm feeling under the weather fever, but a real, I need to lie down kind of fever. This fever can be persistent and may not go away with typical over-the-counter medications. You might feel hot, sweaty, and just plain lousy. This can be accompanied by chills and night sweats, making it hard to get a good night's sleep. Along with the fever, you might also get a sore throat. This isn't just a minor irritation, it can be quite painful and persistent. It's kind of like the sore throat you get with a cold, scratchy, and uncomfortable. Drinking warm liquids might provide some relief, but the discomfort can linger. You might find it hard to swallow, and even talking for too long might irritate it. This can make eating and drinking a challenge, adding to your overall discomfort. Now here's a big one, a rash. This rash can appear suddenly and might be one of the first visible signs of HIV infection. This isn't your average allergic reaction rash, guys. It's often red, flat, and widespread, covering large areas of your body. This rash can be pretty widespread, showing up on your torso, arms, even your face. It can be alarming to see, but it's a common symptom during the acute phase. It might be itchy, or it might just feel hot and uncomfortable. Either way, it's a sign that your body is reacting to the virus. Another common symptom is swollen lymph nodes. These are small, bean-shaped glands that play a crucial role in your immune system. Lymph nodes are like your body's security guards, fighting off infections. When they're swollen, it means they're working hard to combat the virus. When you have HIV, they can get swollen, especially the ones in your neck, armpits, and groin. This swelling can be tender and noticeable to the touch. Remember, these symptoms can be pretty general, right? They can be easily mistaken for other common illnesses. They can mimic other illnesses like the flu. This is why it's so important to pay attention to your body and any changes you might notice. That's why it's so important to consider your risk factors. Think about your recent activities and any potential exposures. Have you had unprotected sex recently? Shared needles? These are significant risk factors that can increase your chances of contracting HIV. If you're experiencing these symptoms and you're concerned, don't hesitate to get tested. Early detection is really important for managing HIV effectively. Now let's talk about some of the lesser-known symptoms of acute HIV infection. These symptoms are often overlooked or misattributed to other common illnesses, making it crucial to be aware of them. While the more well-known symptoms like fever, rash, and swollen lymph nodes are often discussed, there are other, subtler signs that can indicate an acute HIV infection. These are the ones that might not be as obvious, the ones that can easily be mistaken for something else entirely, the ones that might make you think, wait, is that related to HIV? One of those sneaky symptoms is night sweats. These aren't just the occasional sweats you might get from a bad dream or a warm room. Imagine waking up in the middle of the night drenched in sweat, even though your room is cold. It's like your body is running a marathon while you're asleep. That's what we're talking about. These night sweats can be so intense that you might need to change your sheets or even your clothes. It can be pretty alarming, and it can definitely mess with your sleep. Lack of proper rest can then lead to a whole host of other issues, including fatigue and irritability. Muscle aches are another symptom that can fly under the radar. These aren't just the usual aches and pains you might feel after a workout. You might feel like you just had the most intense workout of your life, even though you've been glued to the couch. It's as if your muscles are protesting for no apparent reason. Your muscles might feel sore, stiff, and just plain achy. This can make everyday activities like walking or even sitting uncomfortable. Mouth ulcers are another uncommon but possible symptom of acute HIV infection. These ulcers can appear suddenly and can be quite painful. These aren't your typical canker sores. They can be larger, more painful, and take longer to heal. They can be pretty painful, making it hard to eat or even talk. This can lead to a decrease in appetite and subsequent weight loss. Some people also experience fatigue, like a bone-deep tiredness that just won't quit. This isn't just your average tiredness from a long day at work. It's not just about feeling sleepy, it's about feeling completely drained of energy, no matter how much rest you get. This kind of fatigue can make it difficult to perform even the simplest tasks. Headaches are another symptom that can be easily dismissed. Many people experience headaches for a variety of reasons, so it's easy to overlook this as a potential sign of HIV. But if you're experiencing persistent, unexplained headaches along with some of the other symptoms we've talked about, it's worth getting checked out. These headaches can be severe and may not respond to typical over-the-counter medications. And finally, some people experience nausea, vomiting, or diarrhea. These gastrointestinal symptoms can be particularly distressing and can lead to dehydration if not managed properly. Again, these are all symptoms that can be caused by a lot of different things, but they can also be signs of acute HIV infection. If you're experiencing any combination of these symptoms, it's important for testing. We've covered a lot of ground today, from the more common symptoms of acute HIV infection to the ones that might not be on your radar. Remember, this isn't about self-diagnosing. It's about arming yourself with information so you can make informed decisions about your health. If you or someone you know is experiencing these symptoms, it's crucial to get tested. Early detection can save lives. Don't forget to like, share, and subscribe for more health tips and information.